Welcome, dear moms. The importance of ultrasound scans in the first trimester of pregnancy. Pregnancy is a significant and transformative journey in a woman's life. The first trimester, which spans from conception to 12 weeks, is a crucial period that sets the foundation for a healthy pregnancy. During this time, several medical evaluations and screenings are recommended to ensure the well-being of both the mother and the developing baby. One of the most important tests conducted in the first trimester is the ultrasound scan. This diagnostic imaging technique uses sound waves to create images of the fetus and the mother's reproductive organs. The first trimester ultrasound scan plays a vital role in confirming pregnancy, assessing fetal development, detecting abnormalities, and ensuring the overall health of the mother and the baby. 1. Confirmation of pregnancy. One of the primary reasons for conducting an ultrasound scan in the first trimester is to confirm the presence of a viable pregnancy. Many women may experience symptoms such as missed periods, nausea, and fatigue, but an ultrasound provides definitive proof of pregnancy by visualizing the gestational sac within the uterus. This is particularly important in cases where pregnancy tests may give uncertain results or when a woman has irregular menstrual cycles that make it difficult to determine gestational age accurately. 2. Determination of gestational age and due date. An early ultrasound scan helps in accurately determining the gestational age of the fetus. By measuring the crown rump length, CRL, of the embryo, doctors can estimate the baby's due date with greater precision. Knowing the exact gestational age is essential for tracking fetal growth and planning prenatal care accordingly. This information also helps in scheduling future tests and scans at appropriate times to monitor the baby's development. 3. Detection of multiple pregnancies. A first trimester ultrasound can detect the presence of multiple fetuses in cases of twins or higher order pregnancies. Identifying multiple pregnancies early allows doctors to provide specialized prenatal care, as these pregnancies carry a higher risk of complications such as preterm labor, low birth weight, and gestational diabetes. Knowing about multiple pregnancies from the beginning helps parents and healthcare providers prepare for the additional care and monitoring required. 4. Assessment of fetal heartbeat and viability. One of the most reassuring aspects of an early ultrasound scan is the detection of the fetal heartbeat. A healthy heartbeat is a strong indicator of a viable pregnancy. In most cases, the heartbeat can be detected as early as 6 weeks of gestation. The presence or absence of a heartbeat helps doctors assess the chances of a successful pregnancy and identify potential risks of miscarriage. If an ultrasound shows no fetal heartbeat in a pregnancy that has progressed beyond 6 to 7 weeks, further evaluation may be needed to rule out miscarriage or other complications. 5. Evaluation of uterine and ovarian health. A first trimester ultrasound not only focuses on the fetus but also provides valuable information about the mother's reproductive health. It helps in identifying conditions such as uterine fibroids, ovarian cysts, or abnormalities in the shape of the uterus that could affect pregnancy. Early detection of these issues allows doctors to manage potential risks and provide necessary treatments to support a healthy pregnancy. 6. Detection of ectopic pregnancy. An ectopic pregnancy occurs when a fertilized egg implants outside the uterus, most commonly in the fallopian tube. This is a life-threatening condition that requires immediate medical intervention. A first trimester ultrasound can confirm the location of the pregnancy and ensure that the embryo is developing inside the uterus. If an ectopic pregnancy is detected, doctors can provide prompt treatment to prevent complications such as internal bleeding and damage to reproductive organs. 7. Identification of molar pregnancy. A molar pregnancy, also known as a hydatidiform mole, is a rare condition where abnormal tissue develops instead of a normal embryo. This condition can lead to complications such as excessive bleeding and, in rare cases, the development of cancerous growths. An ultrasound scan in the first trimester helps in detecting molar pregnancies early, allowing doctors to provide appropriate treatment and prevent further health risks to the mother. 8. Screening for chromosome abnormalities. During the first trimester, an ultrasound scan is often combined with other tests, such as blood tests, to screen for chromosomal abnormalities like Down syndrome, Edwards syndrome, and Patau syndrome. The knuckle translucency (NT) scan, which measures the fluid at the back of the baby's neck, is an important marker for potential genetic disorders. Early screening helps parents make informed decisions about further diagnostic testing and potential medical interventions. 9. Early detection of structural abnormalities. While detailed structural assessments are typically performed in the second trimester, some major congenital abnormalities can be detected in the first trimester ultrasound. Conditions such as anencephaly, absence of parts of the brain and skull, and severe spinal defects may be identified early, allowing doctors to discuss available options with the parents and plan appropriate medical care. 10. Psychological reassurance for expecting parents. Pregnancy can be an exciting yet stressful time, especially for first-time parents or those with a history of pregnancy complications. Seeing the baby on the ultrasound screen and hearing the heartbeat provides emotional reassurance and helps parents bond with their unborn child. It also allows them to start preparing for the upcoming stages of pregnancy with a sense of confidence and peace of mind. The first trimester ultrasound scan is an essential component of prenatal care that offers invaluable information about the pregnancy's progress, the health of the mother, and the well-being of the developing fetus. It helps in confirming pregnancy, determining gestational age, detecting multiple pregnancies, assessing fetal viability, and identifying potential complications such as ectopic pregnancies and chromosome abnormalities. Early detection of these issues allows doctors to provide timely medical interventions, ensuring the best possible outcomes for both mother and baby. Additionally, the psychological reassurance provided by an early ultrasound strengthens the emotional connection between parents and their baby, making the journey to parenthood a more fulfilling experience. For these reasons, all pregnant women are encouraged to undergo an ultrasound scan in the first trimester as part of routine prenatal care. Thanks. Take care.